Hi, I'm Mia Malan. I'm the editor of the Bekisisa Health Journalism Center, and I'm here with Laura Lopez Gonzalez, our news editor, who has been investigating the transformation in medical schools in South Africa. This issue has been covered in the news recently. Laura, what do you think of the coverage so far?
I think the coverage has largely been focused on the experience of Wits Medical School. Black students are really unhappy with what they allege is preferential treatment within the medical school. There's also instances where people have said racially or religiously intolerant statements. In the news, we have instances where people allege that tests are graded differently depending on the color of the student. In my own research, students have told me about similar instances, also instances in which they feel they have been targeted after speaking out about racism in the school.
Can you give me an example?
In one instance, a student recounted how Muslim students had asked to move rotations around, I believe, for a religious holiday, and they were not able to do that. However, an instance where another student from a different religion asked for similar allowances was granted.
Laura, students have also been quite outspoken on social media about issues of division. What is your interpretation and what have they said?
One user on Twitter said, "Well done to Adam Habib," who is, of course, the head of Wits University, for taking on the lazy and entitled Wits medical students who think merely attending lectures and clinics should entitle them to a degree. So what I see in this tweet is really a lack of understanding about why Black students feel the issues that they're raising are important. And I think that speaks a little bit to medical school's curriculum.
Have those issues come up while you've been investigating this story?
Sure, I think medical schools are increasingly realizing that our languages, our cultures shape the way we think about disease and health and how we practice medicine. Black students speak about a lack of a level playing field. So for those who came from, for instance, rural schools, they might not have had the actual lab in school. When they get to university, they're going to need a little extra help in the form of maybe tutors. And I think medical schools need to see the value in that and really accommodate students to ensure that they not only reach medical schools, but also complete it and move on to serve their communities.
Medical schools have recognized this, or many of them have. They have transitional programs for students from disadvantaged backgrounds. Many universities allow students from such backgrounds to complete their first medical year over 2 years with the help of tutors. What do you think is still lacking?
What students have told me is that once you're past first or second year, you're still in need of a little bit of extra help, and that help only comes after you've failed. Medical students at Wits are asking for more access to tutors and earlier on, before they fail. I think also there's room to expand access to mental health services because a lot of students are struggling with having to balance excelling at medical schools with figuring out where their next meal is going to come from, where to find lodging, and how people are doing back home. And so I think they're dealing with a lot of different issues.
But what about the lecturers? Don't they need help to be able to understand students' diverse backgrounds and to adjust to that accordingly?
I think lecturers need to maybe change the way that they think about interacting with their students. I also think it's about transformation. So I think if getting more women of color, people of color into lecturer positions, I think will help to bridge this gap. We need to look at medical school curriculum and say, how do you teach people about the social orientation of medicine? So how your social and economic circumstances impact your health, and also how to give doctors a sense of social justice that will underpin the way they practice medicine in our communities.
That was Laura Lopez Gonzalez, the news editor of Bekisisa, and I'm the editor of Bekisisa, Mia Malan. If you would like to learn more about our podcasts, videos, or our articles, you can go to our website, bekisisa.org.